Hello, I'm Dr. Siddhant and I am heading the Rehabilitation and Home Care Unit of SANS Foundation. Today I am going to talk about few useful tips to reduce chest tightness from COPD. The first tip is slow your breathing. As hyperventilation can cause chest tightness and anxiety, slow your breathing down. You want to enforce a sense of control over your inhalation, so focus on slower breaths. You'll relax your mind and your body at the same time. Use breathing techniques such as pursed lip breathing. So the first step of pursed lip breathing is inhale, and while inhalation count 1 and 2. Then on the second step, try to purse your lip as if you're trying to pucker your lips to whistle. On the third step, you slowly breathe out through your pursed lip as if you're trying to obstruct the flow of air and give a back pressure to the flow of air. Second tip is take deeper breath. Always breathe from the diaphragm, meaning your stomach should be the one rising, not your chest. On your right side, if you see, the first step mentions put a hand on your chest and place the other on your stomach. Take a deep breath, feeling your stomach moving outwards. So this is a diaphragmatic breathing where you're using the chief muscle diaphragm to breathe in and breathe out. You can also add counts onto your inhalation and exhalation. A commonly taught practice is inhaling slowly and exhaling slowly. It doesn't matter the size of the breath. Just try to inhale for 2 counts and then exhale for 4 counts. That means the exhalation should be longer than inhalation, so that when we are exhaling, we are emptying the lung completely, and when we are inhaling, we are taking in more and deep breath. The third important tip is fix your posture. On your extreme left, if you see, the person is having a stoop posture. This kind of posture we commonly see in COPD patients because they have a tendency to develop a compensatory breathing which is happening using the accessory muscles of shoulder. As the diaphragm becomes fatigued out and there is hyperinflation of the lungs, they have a tendency to take shorter breaths and use the accessory muscles to breathe. So as a result of this, they start developing a poor posture. So correction of posture is very important so that the lungs get proper volume to breathe and the diaphragm can work, that which is the chief respiratory muscle, to help increase the volume of the lungs. The fourth tip is change your diet. Add more of colored fruits and veggies as they contain more antioxidants, which helps to reduce oxidative free radicals. So you can make a punch of 5 fruits and 5 veggies and make it a smoothie and have it every day to reduce oxidative free radicals. Avoid any kind of spicy food, too hot or too cold. Avoid canned foods, packaged juices, Chinese food, as it contains preservatives. Add more of proteins in diet than carbs. So as COPD is a condition in which patients retain more of carbon dioxide in body, so we advise them to not to take too much of carbs because carbs break down to form carbon dioxide and water. So we have to eliminate any form of diet which will retain more of carbon dioxide in body. So we advise more of protein in their diet because it helps to build up their muscles. It helps to reduce any kind of deconditioning. The fifth tip is seek proper medication. Always be compliant with preventive inhalers. Do not discontinue any inhaler without doctor's advice. Keep on checking with your inhalation technique under the guidance of lung educator. Monitor your immunization schedule for flu and pneumonia shots. Follow up with your doctor regularly, especially during the change of seasons.